Welcome to our discussion on the performance of laboratory testing in culture-confirmed blastomycosis. This 10-year retrospective study evaluates diagnostic modalities across 51 confirmed cases, conducted by Glover and Tao at Vanderbilt University Medical Center.
Blastomycosis is challenging to diagnose due to its nonspecific symptoms resembling bacterial pneumonia. Thoughtful. The causative organisms, Blastomyces dermatitis and B. gilchristii, are dimorphic fungi endemic to North America. The clinical spectrum ranges from pulmonary to disseminated disease affecting skin, bone, joints, and central nervous system. Curious fungal culture is the reference standard, though it is slow, taking 328 days. This 10-year retrospective study at Vanderbilt University Medical Center analyzed 88 culture-positive isolates, including 51 cases with accessible electronic medical records. Curious. The cohort was predominantly male with a median age of 47 years. Notably, 69% of cases occurred in patients aged 30, 60, and 21.6% were immunocompromised. Thoughtful. No blastomyces were isolated from blood cultures. At diagnosis, skin involvement was noted in 33.3% of patients, and bone or joint involvement in 29.4%. Central nervous system involvement was confirmed or probable in 13.7% of cases. Somber. The 6-month mortality rate was 21.6%, with 19.6% of deaths directly due to respiratory failure within 2 months. Fungal culture remains the reference standard for diagnosis. Thoughtful, primary specimen sources include tissue, 37%, bronchoalveolar lavage fluid, 30.7%, and abscesses, 11.4%. Time to growth ranges from 3 to 28 days, with a median of 10 days. Notably, 7 out of 51 cases were diagnosed solely by fungal culture, underscoring its diagnostic importance despite the slow turnaround. Antigen testing reveals a 69.7% sensitivity for urine blastomyces antigen and 46.2% for serum. Curious sensitivity significantly decreases to 25% in localized disease. Notably, all 11 patients who died within 6 months had detectable blastomyces antigen, indicating a correlation between antigen positivity and severe disease. Histoplasma antigen sensitivity is 68.4% in serum and 73.3% in urine, with an overall sensitivity of 78.1%. Curious complete cross-reactivity was observed in urine assays, with 100% agreement among 25 patients. Histoplasma antigen levels were consistently higher than blastomyces, indicating that antigen results alone cannot differentiate between the two. Thoughtful Vanderbilt University Medical Center has adopted a combined non-differentiating assay approach. Antibody testing reveals a critical distinction between enzyme immunoassay and immunodiffusion. Curious enzyme immunoassay shows a sensitivity of 85.7%, significantly outperforming immunodiffusion's 28.6%. Notably, enzyme immunoassay identified antigen-negative cases missed by other methods, highlighting its clinical importance. Cytology and histopathology are crucial in diagnosing infections. Thoughtful cytology shows a sensitivity of 66.7%, while histopathology is at 75.9%. Notably, 4 cases identified fungal infections without definitive organism identification. Curious, 7 antigen-negative patients were diagnosed through these methods, highlighting their importance when antigen tests are inconclusive. EIA antibody shows the highest sensitivity at 85.7% among non-culture methods. Thoughtful, histopathology is crucial for antigen-negative cases with 75.9% sensitivity. Urine blastomyces antigen is a primary rapid diagnostic tool at 69.7%. The 6-month mortality rate is 21.6%, with all deaths from respiratory failure within 2 months. Serious, each diagnostic method plays a vital role. A stepwise multimodal approach is essential for optimal diagnostic sensitivity. Thoughtful fungal culture, cytology, histopathology, enzyme immunoassay antibody, and urine antigen tests complement each other. No single test suffices across all disease types and clinical presentations. Antigen testing is useful but limited, with urine outperforming serum. Enzyme immunoassay antibody testing is powerful, rescuing antigen-negative cases. Thoughtful fungal culture and pathology are essential, diagnosing cases missed by other methods. A multimodal strategy combining these approaches is crucial for accurate diagnosis of life-threatening infections.